Good morning, everyone, and thank you for joining today's Bite. My name is Madeline Holzer. I'm the Education Event Specialist here at Zahn. I'd like to welcome you today. Today we have Milling Reinvented, Increase Your Lab's Profitability. Amir Juzbasic, MDT, is going to discuss some tips and tricks and best practices to increase your lab's profitability using VHF. Would like to encourage you to please use the questions tab at the bottom of your toolbar. This way, at the end of our session, if we do have time, we can address your questions live with Amir. And thank you and welcome, Amir.
Thank you so much for the introduction. As introduced said, I am a master dental technician. I finished my school in Germany and Europe and have been practicing in a laboratory business since 27 years. So today I will just quickly guide you through one segment of the dentistry, which is implant dentistry, and the way we have utilized some of the latest technology to increase our profitability. So I will just give you a very brief overview of dental industry potential. We will go into the implant dentistry, and then we will go into the components, materials, and implementations of our workflows. So as of 2018, there is a 78 million thousand people that they are 65 and years and older. They're going to be in a 2035. That's huge potential for the restorations. Also, there's a lot of people, they have lost teeth in a 65 age category, almost quarter of them. And there is also 1/3 of all of these people, they have a certain medical condition in correlationships to the teeth, which causes also medical insurance to be more involved in a dentistry. One basic example is the sleep apnea process. And then just another statistics is that there is a huge potential of cosmetic dentistry as well. Annually, Americans already spending $2.7 billion on their cosmetic procedures. So definitely the potential in industry is huge. So what we have done on our side, in our laboratory, we are 15-man laboratory. So I came back out of the manufacturing side 5 years ago, and I have been operating the laboratory together with my partner for past 4 years. So we have implemented best practices. So we went for the products that they are very easy to teach and adapt into our team. We look for faster production workflows so we can increase our profitability. And we strongly focus on a better and higher quality of the final products. So I call it easier, faster, and better. So that's the best practices in a basic dental laboratory language. So from the product groups that we have focused was predominantly dental implant dentistry. One segment which is totally new for the laboratory was guided surgeries. We have done almost 8,000 guided surgeries last 4 years, and that has enabled us to control the entire workflow. We established very strong relationships with the periodontist, oral surgeons, all implantologists across, and we were able to control the entire workflow from the start of the case to the finish of the case. Another segment that has proven to have a high profitability with us was immediate temporarizations. So we will make a surgical guides and we will immediately make temporaries. Also, we went into the segment of the custom healing caps besides full-size immediate temporarizations. Another great product that has worked really nice for us was single implant units. These days we do 80 to 90% of our production is implant dentistry, and big portion of that are single implant restorations. We have predominantly focused on screw routine restorations, but as well in many cases that we do not control the entire workflow, we have focused on customized abutments with the option of in-house milling. So another segment that has helped us grow our laboratory 500% over this period of the time are the full arches. So we have educated ourselves with immediate loading protocols All-on-4, All-on-6, All-on-X, however people like to call them. And we have implemented close relationship on a regional level with the oral surgeons, periodontists, overall implantologists, and we have implemented the entire process of the preparations, surgical execution with a surgical guide, immediate loading with temporaries produced in-house, and then very simplified workflow of final stage with the 2 trines and 1 final delivery. So to be able to produce all these high profitable products, we have selected components of digital implant dentistry. So the 3 components that are most important currently right now, there's the software, including CAD and CAM softwares, manufacturing technology, and the materials. On our software technology, we have invested and committed to the 3Shape platform. The major reason for it was strong clinical directions from a 3Shape, as well very close integration with all other segments, materials as well, the CAM softwares and the milling and printing technologies. Also, the portfolio of their modules has enabled us to really easily communicate directly with the offices, but also internally in our operation. The one major foundation of that we have done also on our side was implementation of the centralized servers. So we eliminated all the dongles on the computers, and we get much better efficient workflow. From the guided surgery standpoint, we have also worked on the 3Shape platform, and because of our certain level of strategic relationship with the Straumann, we have also implemented co-diagnostic guided surgery software for them, mostly for their stackable guide options. Our strategic partner on a milling side, after intensive research and due diligence, has become VHF. We really like their product lines because they have offered the wet milling options. N4 is a fantastic milling machines. If you like to quickly and efficiently mill your Emax crowns, or if you are milling in-house titanium abutments provided by your authentic manufacturer provider of the blanks. So the quality of the titanium abutments was very satisfactory to us, and the milling time, which ranges around 25 to 30 minutes, was as well acceptable. So they also did a validations on their milling machines, which give us some additional peace of mind that the machine and the products are correctly validated, and that we have really good consistent results with in-house production. From the standpoint of the 5-axis milling machine, we have looked into the multiple machines before we committed to the VHF, but definitely we did find out that we preferred a little bit more German manufacturing philosophies, which is based more on the heavier constructions, more stable construction versus more Japanese style of plastic and easy replacements. We do mill a lot of complex cases. Like I said, 80% of our cases is implant dentistry. So we definitely need a robust machine with a consistently high precision product output. So definitely K5 Plus exceptional machine to utilize in any range from single units all the way to the full arches. And last year we have also acquired S5 milling machine with automatic disc exchanger, which enables us to do multiple discs. I believe it goes up to 8 or 10 discs. So this way we can mill disc different thicknesses, different shades, and different material configurations. So that has helped us definitely with our workflows and our efficiencies during the day. We went through the CAM software evolution. So what I have to say is that VHF has made tremendous progress the last 3-4 years in the development of their CAM softwares. So we are fully satisfied with the speed of their milling, utilization of the strategies, and most definitely the final product outcome before we go into the final manufacturing stage of sintering, polishing, etc. Which is really important for every laboratory. All this equipment is a huge investment. And if you do not properly maintain it, if you don't correctly calibrate it if needed, definitely you're gonna see a lot of disappointments and very expensive repairs. This is same like a car. If you don't replace oil on a time, at one point you're gonna have issues with the engine. Same thing with calibration and rotation of your tires on a car. So we take that seriously. We have our daily cleaning cycles. We have our weekly, our monthly, and quarterly evaluations of our machines. From a basic dust collections all the way up to monitoring the spindle hours, so we can accordingly replace it. So it's very important to follow the manufacturer recommendations and not just go by a feeling. Like we technicians, many times we like to say, hey, spindle can go 2,000 hours, I'm milling already 2,500 hours, I'm still getting good results. So definitely you're going to affect your machine, or you're going to affect your quality of the products if you're not following the recommendations. From a printers, I want to also a little bit address that because it's a very important topic. We have went also through evolution of these printers. We started with the form labs because that was the most cost-effective process for us, learning the printing technology, getting familiar with it. There's a learning curve with every technology, with every product line. And last year we have fully switched after the testing into the SIGA printers. So we are using the smaller version printers. We are fully satisfied with them. We are getting faster printouts, better quality, more detailed oriented in compared to the form labs. Definitely also the cost of this printer is 3 times more than the form labs, but we also strongly believe that the quality consistency is more than 3 times better than what we were getting from a form lab printers. So on a printing technology, there is a huge development in these materials. So that's still a huge gap and a lot of room for improvements. We have a basic philosophy in our operations that we do strategic commitment to our industrial partners. So we have used for many years Keystone products. And I have recently visited their manufacturing facility located in New Jersey. So they are doing fantastic job. So amazing quality of their printing products. They coming with such speed with the new materials. One of the products that we are using from them is called Keyprint for our surgical guide. It's a very consistent material. If you're in a printing technology, printing surgical guide, highly recommended. We have also started printing the models with their new printing material for the models. It is very cost effective because they have reduced the price, make it very good entry point even for the smaller laboratories, not only to acquire technology, but also have a consistent and cost-effective results of their models. So, and we have been testing some additional materials for them as well. So we are beta tester as a laboratory for several leading manufacturers in the United States and worldwide. And it's very exciting what they have in a pipeline. Highly recommend to follow them and to try to utilize their products if you haven't yet implemented in your laboratories. One product that we have also committed, we have a strong relationship with Ivoclar. So our zirconium, we mill a lot of zirconium, and we have decided to go with their Emax Prime blocks for multiple reasons: gradient technology, high-end aesthetics. We can cover all the indications for a single unit to round arches, so we don't need to switch between the blocks. So that has worked really nicely for us. The one product that that I have been working for, so this is 2005, 2006, has been 15 years, is a GC initial line of the products. I was one of the first technician who has traveled through the whole United States, Canada, and taught the courses on the initial together with technicians like Oliver Trick and a couple other, Luke Kahn and a couple other technicians who do a lot of education. So this product has proven to be consistently good over all of these years with all their platforms that they offer. The one product which we really like is their liner product lines. It creates a really good bond for our zirconia. That was always issue on the zirconia. How do you bond your ceramics into the frames? So we have developed the strategies to utilize the liners and eliminate any delaminating and chipping of zirconia. So we use their also products for layering. These days we don't do any more extensive layering. Mostly it's micro layering or pink tissue layering. So if you don't use their products, definitely try this really good product line. And GC is really another consistent company for providing great products. Doesn't matter if it's stones, composites, or ceramics. So this is one of our double arch case. I have put some additional slides. I'm gonna just try to introduce you to a couple more product lines. Another company which has also positively surprised us with their quality of the products is a Harvest Dental. So for milling line, we are using their for temporary restorations. I think it's called Temp Aesthetics. So they have great aesthetics, they're very strong, they're very easily to finish. And in combination with the VHF machines and their milling strategies, we are getting really good, almost 90% finished product directly out of the machine. So we have also looked into some different emerging materials, high performance polymers. One of the products that we have tested was Jawor for our bar needs, for our locator supporter frameworks for different applications. But we have settled down on this Harvest dental material called Trilor. It's a fiber reinforced resin. It comes in two shades. It comes in opaque shade or bone shade, and it comes recently they released it in this pinkish shade. This is the revolutionary product for in-house production for us in implant dentistry from a standpoint of elasticity, millability, applications. So we use it in a different range of the products, and our goal is always when we get the material to cover as much as possible indications for us. And this material has definitely, as a substructure, covered majority of our needs besides zirconium and besides the PMMA. So I will highly recommend again to try this material. It's a fantastic product. I'm good with the time, so I have another 10 minutes. So what I will do, I'm going to show you some sample cases, so you can see how we are taking milling and printing technologies, materials, CAD software, SCAM softwares, and we directly applying it into one of these profitable segments. So I will show you one basic case. It is the lateral to number 10. So I will guide you now through the process of the merging product between the bone tissue merging I'm utilizing here Implant Studio from 3Shape. As we all trained in the industry, it's always the best to do first anatomical wax up and then work off there, which now with the digital technology is very easy and very efficient. We positioning the implants in an ideal position in core relationship to the ideal prosthetics. The surgical guide is created, the drilling protocol, surgical reports for your implantologist, the surgeons, periodontists, they are generated as well automatically. From there, we exporting the files, we continuing with the 3Shape comprehensive software. So, and then there we are designing our immediate temporary. So here we are printing our surgical guides. We are milling our PMMA, and then we are assembling it with the type A's. This is the day of the surgery, just before the extraction. So in this case, prosthodontist is executing the case. He's gently removing the tooth, placing the surgical guide, utilizing the guided keys and the drills based on a drilling protocol sequence, and positioning the implant into the correct depth, and then positioning the temporary in a place. So what used to be our 30 minutes procedure for someone even very skilled like this perioprostodontist, this has become more or less 15 to 20 minutes procedure from a standpoint of automatic extractions, placing the surgical guides into place, going through the drilling sequence, placing the pre-selected implants into the ideal positions, and having just screw retain crown to be placed exactly into the position. So as you can see, just basic example on this one, we have manufactured the surgical guide, we have manufactured the temporary, and definitely this crown has been ideally placed, tissue has been maintained. We are getting perfect screw retained retentions through the cingulum on the posterior. Once this case come back to us, there's not much guessing. There's not, oh, do I need to do the pink tissue? Which parts I need to order? Which the gingival depths I need? We already all pre-selected. We are fully in control, and we can control one of these most difficult cases in a 6 through 11 aesthetic segment in very predictable, consistent way. And we do it repetitively. It doesn't matter who does it. So this is another example of the two crowns, 8 and 9 placed to each other. So once you trained and synchronize with your clinical partner, you can repetitively do these cases. There is definitely sensitivities, technique sensitivities in there. So it needs some synchronizations between the laboratory and the clinicians, and slightly deeper understanding of implant dentistry and placement. But it is possible to do multiple units as well next to each other and pre-mill with the pre-milled objects. So this is a proven procedure. It is very well documented in literature that immediate extractions with the placements in combination with the grafting and temporarizations and the day of the surgery will prevent tremendous bone and tissue loss, which is always crucial for us for perfect aesthetics. So as you can see, this is that same case with the two crowns. Just 1 week, 1 week later, based on the pictures, as you can see, 2/15, 2018. So these are taken 1 week later, 2/20, 2018. So you cannot almost see the difference that two teeth in a front area have been extracted and two teeth will be immediately temporized. The tissue has perfectly adapted to the new temporaries. So this product has been milled with the VHF machines. The temporaries have been made with Harvest Dental PMMA material. So I will try very quickly just to go through the full arches, so we have another 5 minutes. So full arch procedures, they are very well documented, and their success rate also has been proven. We have a 3 definitive stage that we do in our laboratory. One is the pre-planning stage, the other one is the surgery stage, and the third one is the restorative stage. In the first stage, we always try to collect all the informations. In a surgical aspect, we do the guided surgery execution, we do immediate temporizations, and we make a master cast. So in the restorative stage, we created the Swift appliance, which is the replica of that what has been delivered on the day of the surgery. We go with one additional final try-in if needed, and then we go to final delivery. In many cases, we are able to finish cases just by one try-in and then going into the final delivery. So this is one basic case just to demonstrate the way we do it. So we get the bone informations, we merge it with the pre-wax subs. We ideally place the positions of the implants. We pre-select the correct orientations, gingival heights of the multi-unit abutments. This is immediately on the day of the surgery, the way it was immediate loaded, and this is the immediate temporary unit position. So this is what patient goes home with. We have exactly the replica which we collect on the day of the surgery, and then from there we enter the restorative stage. So this is just the surgical sequence, the way these cases have been done. Another case. Again, we prefer to use on our case the zirconium bridges. We have bent away from this 15 millimeter reductions to more 10 to 12 millimeter reduction, and we call it the non-invasive approach to the implant dentistry. I'll just quickly show you one case. So you can really pre-plan position of the implants with the multi-unit abutments, do the correct angulation changes, prepare the surgical guides, and immediately temporarize these restorations. So this way you can also, as you can see, immediately 48 hours later, so the teeth have been only extracted, the immediate temporary has been placed, and the final restoration has been delivered. So basic conclusion from my side and from our experience is that manufacturing dental appliances with the VHF milling machines, currently available CAD softwares and material categories, we have achieved very reliable and consistent processes. I will highly recommend you to utilize all these materials and all this equipment that I have suggested, and definitely will increase your bottom line, and it will reduce your production time. So
Thank you, Amir.
thank you so much. Yeah.
Thank you. We do not have any questions currently in the queue. I know we have another 2 minutes. I just wanted to bring all of your attention to the fact that we do have a full hour webinar tomorrow with VHF on streamlining your milling workflow. Tomorrow we'll be joined by Nicholas Rode, the CEO of VHF, and Michael Jackalone, training support specialist. So it should be a great hour of information there with regards to streamlining your workflow and VHF's product line to help you do that. We appreciate you joining us today. And thank you, Amir, for your expertise and knowledge this half hour. I know it's been quick. Everyone have a great day.
Thank you. Have a great day.
Thank you. Bye-bye.